Health has some of the highest rates of occupational violence and bullying in the country. It's so important to us to change that reality so our staff are safe, that they know that we care for them and that we'll take action when they do raise concerns. We can't expect our staff to care for our community if they're not cared for themselves.
We had a couple of years of People Matter surveys that showed that people do not feel safe to speak up. Only 15% of people felt safe to actually raise concerns. And it's fantastic to see that now 96% of people feel safe to speak. So it's significant improvement from where we were. RespectX is simple, it's easy to load, it's easy to enter, even I can do it, and people feel safe.
A wide range of staff, from junior staff to senior staff, clinicians and non-clinicians, are actually using the platform to raise concerns. I think our staff have responded so well to RespectX because it's so easy to use. It's at their fingertips 24/7. Most of them are reports that we would never have received before. About 80% of our reports are informal reports and telling us about the little niggles that are bubbling away under the surface, and they're the things that actually we really want to focus our efforts on so that things don't become big issues.
We were really worried that we would get quite a lot of vexatious complaints through the system because it's so easy to report, but that hasn't been our experience at all. I think RespectX is allowing us to identify where some key areas are and then work with those managers more closely to support them in managing things at that early stage.
We have about 5,500 staff and volunteers. We have 29 sites where our staff are located, so we can't be everywhere all at once. What RespectX has given me and my team is that ability to work more broadly across our whole staffing group and to see the issues as they arise.
Look, all health systems are under pressure, and we can use it as an excuse not to do things that are tough. The reality is it's my job to know, and we've got to find every mechanism we can to actually ensure that we do know, that we do hear and that we can act. What we need is tools that enable us to do things easily. Look, we all have our fears, and my fear is that our staff or our patients are unsafe and that we don't know. And RespectX has raised both staff issues and patient issues, and that's important to me.
Because people know they're going to be held accountable through RespectX, it means that people are actually taking more accountability for how they're behaving. Being able to communicate anonymously with a reporter has been a game changer for us because it means that people are coming forward.
RespectX has really changed our reporting culture, and it's enabled us to hear lots of issues around both clinical safety and staff safety. We can only fix it and treat it if we hear about it.